Hi everybody, I'm Dr. Neeta Jain. I'm a pediatrician at the Snoqualmie Valley Hospital. And it's a great pleasure today to be here. And I want to talk a little bit about Torticollis and introduce our most amazing physical therapist here who works extensively with children with Torticollis. So when the children are born, sometimes they keep their head on one side and the head stays tilted on one side, and that's what we call Torticollis. And many children have it. And how do I diagnose them is when I see them for the first time, I examine them. And when I see them tilted on one side, I try to bring it in the center. But if they keep on tilting it on one side and then the rest of the body also moves towards one side, I feel like that is the time for me to look on this physical therapy aspect and send that kid, because as Melanie will talk to you, there are so many annotations which are associated with Torticollis. And so I then will check these kids, will tell the parents to do the necessary precautions that they can take, because every child likes to keep their head on one side or the other. And then if that doesn't work, we refer them to physical therapy. So I am going to introduce you guys to Melanie, who's our physical therapist here, and then she will explain a little bit more about what she does, what are the interventions, and how we can help, and why is it so important to think about it and remedy it. Thank you.
Thank you, Dr. Jain. My name is Melanie, and I'm a physical therapist at Snoqualmie Valley Hospital. I love working with babies and young children, and I want to share some information on a condition that I commonly treat called torticollis. Torticollis is a common condition in babies. It happens when a muscle in the neck, called the sternocleidomastoid, gets tight on one side. This makes the baby's head tilt their head and turn their neck to the other side. It can happen for a few reasons. It may be genetic and run in families. The baby may have been cramped in the womb in a certain position during pregnancy. And the baby may spend too much time in car seats, bouncers, or carriers, which can make them look to the same direction all the time. If a baby always tilts their head to one side, it can cause a flat spot on the back of the head called plagiocephaly. It can cause problems with feeding, vision problems, and delay in gross motor skills. If a baby always turns their head one way, they may not be using both sides of their body equally, which can slow down things like rolling over, sitting up, or crawling. In physical therapy, I can show you how to gently stretch the baby's neck, use tummy time to help strengthen muscles, encourage the baby to look the other direction, and other activities like that to progress their milestones. The earlier we start treatment, the better. Physical therapy can start when the baby is as young as 2 weeks old or even younger. If therapy starts before 3 months old, the baby should improve in just a few months. If therapy starts between 3 to 6 months old, it might take more like 6 to 10 months. Torticollis is very common and can be treated with physical therapy. While treating torticollis, I also make sure that your baby is reaching important milestones like rolling over or sitting up. If you are worried about your baby's development, talk to your doctor and ask for a referral to physical therapy at Snoqualmie Valley Hospital. Thank you.